Hi everyone. We're going to talk about the hyperkalemia protocol. So this is the protocol that is ordered when you have a critical potassium level. So your initial K level here is going to be put in, and then the provider will order this. They will use the Epic Order Hyperkalemia protocol order set. And what they'll do is order that. You will, as the nurse, go to the CCS tower and grab the cheat sheet. So this is the cheat sheet, as you can see. This is in the hyperkalemia protocol area on the tower. So your patients need to have this order in Epic. They also need to have continuous ECG monitoring, and then they'll need some lab work as well. So if the patient is on digoxin, you need to get a stat dig level. There'll also be orders for BMPs every 2 hours times 2. And then you'll go to step 1 and 2. These need to be done together in a timely manner to be effective, because if they're done together and timely, it helps pull the potassium out quicker. So once you start getting these bags and medications together, you need to make sure that you need to see if the order is for 3 grams versus 1 gram, and that depends on how long you'll be pushing those medications. And then you're also going to look at your initial glucose level. That is usually from the initial or last KIM or serum that was drawn. You'll put that level in, and then that will determine what pharmacy will mix up for you. Pharmacy will mix the hyperkalemia bag and send it to you via tube station. So the hyperkalemia bag will be either normal saline with insulin or D10 with insulin, and that's based on the blood sugar. So if it's greater than 250, you're going to get normal saline. If it's less than 250, you're going to get the D10. So, like I said, those bags need to be given closely together. And then what you'll do is retime your BNP to be 2 hours after this is completed. Then you'll go to step 3. Step 3 is the AccuChecks with treatment. You're going to do 3 AccuChecks in 3 hours. So the AccuCheck needs to begin approximately 1 hour after the hyperkalemia bag is infused. So you may have to retime your AccuChecks as well. Then after your AccuChecks are checked, you need to look at the chart below to see if it needs treatment. So like I said, if the glucose is greater than 100, no dextrose. 70 to 100, you'll get 1 amp of dextrose. And then if it's less than 70, you're going to get 2 amps of D50. So that is what you need to look at after every AccuCheck. Then you have your BMP that's going to be coming in. So usually around that second AccuCheck is when your BMP is going to result. That potassium level is what you're looking at. So if that potassium level is still critical, you need to contact your provider, because the provider may want to order the hyperkalemia protocol again. And if that is reordered before your AccuChecks are completed, you still need to continue your hourly AccuChecks until your step 1 calcium gluconate is given. And then if that happens, then you're going to stop doing those AccuChecks and basically restart this whole protocol all over again. Other than that, that is pretty much it on the hyperkalemia protocol. If you have any questions, don't be afraid to reach out to your charge nurses or other staff. We're here to help, and this is the hyperkalemia protocol. Thank you, everyone.